All right, we're going to be talking about lips. What's the ideal lip? And if you don't have the ideal lip, what does it take to get it?
Exactly.
Dr. Cogman.
So there's obviously the upper lip and lower lip, and they both have different qualities that we as a society have deemed beauty or beautiful. So the upper lip actually should have about a 2 millimeter over projection from the lower lip, and that's on a side view. That's what you would want to see.
So on a side view, you want the upper lip to be slightly over projected.
And I don't know if this guy has it or not, but that isn't a female that I'm talking. So there's also these two peaks. They're called Cupid's bow. And that should come one arch here and one arch here. You notice it on pretty faces. For instance, this is Eva Mendes. Get her close to the camera here. And you can just appreciate how nice and full and how much red lip she has showing. And then she has exactly those two Cupid's bow, which is it's attractive. So those should be located just on the outside of this base of the columella, which is where the middle part of the nose attaches to the face.
And you get that slight indentation here. So that's where the Cupid's both analogy comes from. So what about the ratio of the upper lip to the lower lip?
The size, yeah. So there's different theories on which lip should be larger, right? I mean, if you have this lower lip that's really pouty and pretty, but it's typically a 2/3 ratio that you would want.
So you want 1/3 to 2/3.
Exactly. And that's pretty much the best way to think about it is the red show of the lip, like the actual, red mucosa. That's what we're talking about.
Yeah,
just
the
from
pink.
A frontal
You
view.
want to show a little pink. And actually, you know what? The lips are probably the only sexual organ that society allows us to show.
That's a good point.
Bam.
I like it.
So,
So show it off, you make it look good at least.
yeah.
If it's the only
What about
sexual
lobules of the lip? How do lobules, if you want a little fullness, how does the lobules of the upper and lower lip relate?
So the fullness, we can gain the fullness by a couple different techniques, but the lobule is kind of this central, almost like a bulge, I guess is the best way to say it. So you should have kind of one lower lip is a kind of a full pouty bulge, maybe with a little depression in the midline, but the upper lip has these two distinct separate lobules or bulges.
So it's okay to have a bulge here, but how do you do that?
So,
How do you do it?
There's a couple ways. The simplest way is with a filler, like a synthetic material that we put in the lips with a cannula. We make one poke here, and then we're able to put it under the mucosa and under the muscle and to fill volume. So a filler is one option. Fat, personally, I believe is the best option. Similarly, we use a cannula to fill the lip with fat.
And the cannula being a little blunt tool that goes in and essentially prevents, as opposed to a needle, which is sharp.
And if all you want is increased red lip, increased mucosal show, we can do a lip lift procedure, which I'm pretty conservative with because it creates a scar. But you make an incision all up under the nose here, into the nostril, around the lateral nose,
and then just lifts the upper lip.
And you remove some skin and pull it up. So it has to be for the right patient. But come in, we can talk about options.
Lots can be done for lips. So come in and let's talk about lips.
All right.
Adios.